I'd like to introduce Dr. Henry Mannings from the Star Throwers charity in Windham, Norfolk, UK. Thank you for joining me, Henry.
My pleasure.
I understand that you prescribe LDN for your cancer patients. How long have you known about LDN?
Well, I've known about LDN for about 4 or 5 years now, and as I say, it's one of these treatments you hear people are using when nothing else is available. And initially, I doubted there was much behind it, but certainly as time has gone on, I'm far less sceptical about it.
Mm-hmm. How many patients would you say you've treated with LDN now?
I think we've probably treated somewhere between 20 to 30, and I have to say the best thing about it is the less of the fact that there are very few side effects from it. And the other thing I have been impressed with is the type of people, as I say, that are on LDN are the people who have been usually told nothing else that could be done for them. And overall, although we've seen no tumours actually disappearing, people are actually saying, the disease does not seem to be progressing in the vast majority of them. And we have a couple of cases now where it's 2 years on when people were diagnosed. I think one in particular with gallbladder cancer with secondaries in the liver, and she's got no evidence of any disease progression whatsoever. And we have another chap who's been on it now. He must be about 18 months with a stage 4 lung carcinoma. And so that LDN is the only treatment he's actually taking. So it's unlikely to be anything else that seems to be stabilising his disease. And but I think the nicest thing about it, as I say, is the fact that people have no side effects from it. Mm-hmm. And the other most important thing is it's not an expensive treatment.
No. And these people that you start on the LDN, do they notice any introductory side effects?
Basically, I've had no side effects at all, with the exception of one woman who had diarrhea when she increased from the 3 to 4.5 milligram. But I've noticed on the website there are people who have side effects, problems with sleeping, but I haven't seen this at all.
Mm-hmm.
As I say, overall, as I say, it seems to be a very nice treatment from the patient's point of view. Mm-hmm. And as I say, I'm very, very pleased to hear that we're going to get some proper trials into LDN to show whether it is effective or not.
Yes. People will be interested. What kind of cancers have you treated so far with LDN?
We've treated, as I said, lung cancer, gallbladder cancer spread to the liver, bowel cancer, again with liver metastases. We treated a woman for quite a long time with breast cancer with secondaries in her brain. In fact, we've covered, I would say, with those are named. It has been bowel, breast, and upper GI as well. But as I say, I think it's one of these treatments, because of the way it works, or the way we think it works, that most tumours would be amenable to it. Mm-hmm. But as I say, it's only further research into the incidence of, or prevalence, I should say, of opiate receptors on tumours, which is how LDN is theoretically working. Also, as well as the effect on the immune system, will actually tell us if LDN is actually useful for all tumours or only for a specific group of tumours. I think, you know, as we come into sort of cancer medicine generally, we're aiming for much more targeted treatment, and by that I mean, you know, we're looking at the actual individual tumours and seeing what type of receptors are on the surface of the tumours, and then treating the patient with the appropriate drug to target that particular receptor. And I suspect that LDN is going to fall into this category, that there'll be some tumours which LDN will have no effect on, and others it will definitely stop the growth.
Mm-hmm. Now, for people in the UK, and I know you said that you also help people in other countries, how would people get hold of you?
Well, as I say, we have people contact us from literally all around the world. We've had, you know, surprisingly, even places like Iraq, Afghanistan, Australia, New Zealand, South Africa, and South America. And basically, it's very hard sometimes to actually treat these people, but I can certainly try and give some advice. And we have a basic rule here at Starthrowers that anybody who writes in for advice, so if they do it by email, or whatever, or letter, they're always replied to. And I think the most important thing about our charity is that you know, it's completely free. Everything we do here is absolutely free, so there's no cost to the patient. We don't believe people who are going through the hell, basically, of being treated for cancer should have to worry about sort of financial problems on top of all that.
Mm-hmm. Now, what's your web address, Henry? Do you know it?
Yeah, I mean, the Starthrowers is based in Wyndham in Norfolk, and the address is 3030 Melton Road, and that's the postcode is NR180DB. Mm-hmm. And I say we see patients from absolutely anywhere. I say, you know, if people want to be seen, definitely for sort of second opinions or whatever, we are available. They just have to ring up that phone number, which is 01953 423304, and they can make an appointment to come and see me. And the nicest thing about it is we're not like a clinic or a hospital. It's more like somebody's home, and the reception you get when anybody arrives here is something that nearly every patient comments on and is especially thankful for. We give everybody 1 hour of our time, so there's no rush. And this is the problem with a lot of the sort of hospital consultations, because they are exceptionally busy. They have sort of usually about a maximum of 10 minutes per patient, and a lot of people feel they haven't got the time to ask the questions they want to ask, or they walk out and they suddenly realise they needed to ask their consultant something, but there's now impossible for them to go back in. But when they come here, I can go through everything they need to know and explain all aspects of the disease and treatments available. And with my sort of vast experience in oncology, I can talk about sort of both conventional and non-conventional treatments.
Mm-hmm. And on that note, how many years have you been working in oncology?
Right. Well, actually, in oncology, I've been working over probably about 12 years now. And, you know, previous to that, I was, I've always done sort of hospital-based medicine and also family medicine. But, you know, I've been involved in teaching both the junior doctors at the hospital for their higher exams, and I've also been involved in teaching at the local university, educating the medical students on all aspects of medicine.
Mm-hmm. Well, if I can also just give people your web address, which is www.starthrowers.org.uk. And I have to say, when I came to meet you, your staff, everybody was wonderful, and I'm sure that people will contact you on the strength of this, and good luck with everything.
Thank you very much indeed, Linda, and it was a pleasure to see you here. And as I say, I'm sure as we get bigger and bigger, so will we research into LDN, and hopefully that will be one of the treatments which will be proven in the next few years to have a good effect and make people's lives more pleasant and without having to go through other treatments such as chemotherapy.
Mm-hmm. Thank you, Henry.